So let us one question that Dr. Shrikant has also discussed: derivative of NCC, neural crest origin. See, this is very, very clear. The answer is retinal pigment epithelium. The fourth choice that Dr. Shrikant has told is melanocytes. We have done this in our classes. We please remember the optic vesicle, and this we have discussed. The optic vesicle which comes from the neuroectoderm. Okay, remember the optic vesicle which comes from the neuroectoderm. It forms like this. Okay, and I've told that the inner layer forms 9 layers of retina, and the outer layer is the outer layer is giving the retinal pigment epithelium. That is why the layers separate. Okay, that is why the chances of detachment is between the inner 9 layers and outer. So neuroectoderm is what is giving rise to the retinal pigment epithelium. This is very, very clear. And also we remember the mnemonic is crest, NCC, neural crest. This mnemonic we have done. Remember? Okay, crest. Yaad hai crest? Okay, CR is corneal, E endothelium, S stroma, S sclera, T trabecular meshwork, ciliary ganglion, and ciliary muscle. These are all from the neural crest. है ना? याद आया? हाँ आ रहे हैं. Dr. Sahil, we are coming to macular dystrophy also. But इस क्वेश्चन को तो कर ले NCC. So retinal pigment epithelium is coming from the neuroectoderm. It is not coming from the neural crest. Okay, that is very, very clear. One question was on the normal A is to B ratio. Normal question, A is to B ratio. Normal A is to B ratio is 2 is to 3. 2 is to 3. This we have done, where we have done about the AV crossing changes. Yaad hai? AV crossing changes. Salman Khan, Salu sign coming on the bonnet carrying a gun. Okay, है ना? वो किया था ना, याद है? आ रहे हैं डॉक्टर साहिल, डॉक्टर अनुष्का, प्लीज डोंट राइट. वी आर गोइंग टू कम टू दोस क्वेश्चंस आल्सो. पहले इसके चॉइसेस, एनीबॉडी कैन एनीबॉडी गिव मी द चॉइसेस ऑफ दिस? व्हाट आर द चॉइसेस? Normal A is to B ratio is 2 is to 3. That is normal A is to B ratio. है ना? Hypertension में we have done, there is arteriolar narrowing. So normal A is to B ratio is 2 is to 3. जो hypertension में in hypertensive patients it tends to become 1 is to 3. This we have done in our class. है ना? 1 is to 3. Okay, so the choices were 2 is to 3, 1 is to 3. The choices were 2 is to 3, A, B, 1 is to 3, C, somebody is telling 1 is to 5, and 2 is to 5. Okay. So these were the choices. Out of this, the correct answer is going to be normal A ratio is 2 is to 3. Okay, 2 is to 3 is the normal ratio. Okay, correct? Good. So this is what is hypertensive retinopathy, where the arterial narrowing results in changing into 1 is to 3. Normal is 2 is to 3. Correct? Please remember this. Now, this question that you are all talking about, macular corneal opacity. There are 3 types of corneal opacities: NML, nebular, macular, and leukomatous. Okay. So these are the choices. Were these choices? Iris it is not seen, pupil margin not seen, both not seen, both are seen. Was this the correct answers? Were these the choices? Please tell me, were these the choices? Nebular opacity is one which is barely visible opacity. It is a barely visible opacity, and you can see all structures are clearly seen, across it. Okay. Macular opacity is a easily visible opacity. Iris is seen, but details are not clear. Iris is seen, but details are not clear. Details are not clear. Okay. So iris details are not clearly seen. This is correct. Leukomatous opacity is one where through which you iris and pupil both cannot be visualized. It's a total opacity. Okay. It's a total leukomatous opacity. So this is iris details are not seen. Okay. Anybody having any different choices? Anybody had any different answers? Iris details seen. Okay. So you are saying iris details seen, pupil margin seen, pupil margin seen, both seen, both not seen. Acha, both seen and both not seen. So then the answer would become pupil margin seen. Then the answer would become pupil margins are seen. Iris detail is not seen through the macular corneal opacity. Okay. Iris details are not seen through the opacity. Okay. So then if these are the choices, then the correct answer would be pupil margin is seen through the macular corneal opacity. Okay. Yes. Is seen. Okay. Let me just write this nicely. It is seen. Correct. Correct. Okay. Is that okay now? Good. So next, moving on to the next question. Okay. So this was the superficial stroma, 1/3 and more than half of the corneal thickness is your leukoma, This is histopathologically, okay? This is less than half, and this is absolutely superficial opacity. This is your nebula, correct? Okay. Yes, only pupil margin seen. Only pupil margin seen would be the correct answer then. No pterygium. Was there a question on pterygium? I've not seen a question on pterygium. Nobody in the group has told me, Dr. Aki. Nobody in the group has told me about any question on pterygium. Okay. Now, one question was where they were given a 34 weeks period of gestation neonate with a leukocoria on C3 and intraocular calcification is seen. Intraocular calcification, I've told repeatedly, is only seen in retinoblastoma. Only retinoblastoma is a choice where you can get an intraocular calcification. So this is very, very correct. Okay. Can anybody tell me the fourth choice? Was there a fourth choice? There was a question on pterygium. Okay. If somebody can post the question pterygium, pterygium is something that we have done repeatedly in our classes. So if you can tell me what was the question, you can tell me on my WhatsApp number. This is my WhatsApp number. Just text me, whoever can. I have not seen a question on pterygium. Pterygium increase the risk of astigmatism. Yes, that's the correct choice. Pterygium causes astigmatism. This is very clear. This is very, very absolutely clear. Pterygium causes pain, astigmatism. Pterygium does not cause pain. It causes astigmatism. Acha, the fourth choice. Thank you. Thank you. Thanks a lot, Dr. SSTS. It was Coats disease. Somebody is telling it's a Coats disease was the fourth choice. So this is the mnemonic on leukocoria that we have been doing. So congenital cataract, coloboma, Coats disease, retinoblastoma, ROP. I've already told you ever retinoblastoma is the only one where you will see a calcification. In rest all other, we do not see a intraocular calcification. Okay. Okay. So that was 1 year premature. Okay. 1 year premature neonate. Okay. Okay. So we'll come. I note down the pterygium question later. Pterygium was also a question they are saying. One very interesting question that came. Patient presents with bilateral, sudden onset, painless vision loss. Bilateral, sudden onset, painless vision loss. The choices that I've come across is diabetic retinopathy, iridocyclitis, glaucoma. Glaucoma and iridocyclitis are not painless. They will be having pain as a feature. Okay. And bilateral, unlikely, but diabetic retinopathy will result in a painless, sudden vision loss. Why sudden? In case of a patient with a PDR, proliferative diabetic retinopathy, patient can get a vitreous hemorrhage and can develop a bilateral sudden onset vision loss. Okay, bilateral sudden onset vision loss. Okay, keratoconus was also an option. Okay, keratoconus was also an option. Okay, even in keratoconus, if there is going to be a sudden vision loss, it will be because of eye drops, that is sudden swelling of the cornea. But high drops is also a painful condition. It's also a painful condition. Okay, so the correct answer would be congestive glaucoma. Okay, so you are saying this was congestive glaucoma. I'll correct this. This is congestive glaucoma. This is one thing. Keratoconus is one thing. Okay. But the correct answer remains diabetic retinopathy. That is there. Okay. Sudden onset, painless diminution of vision will be, yes, vitreous hemorrhage because of diabetic retinopathy. No doubts in this. Okay. Okay. Congestive glaucoma or somebody saying an angle closure glaucoma. Both are the same. Okay. That is good. Thank you, Dr. Deepthi, Dr. Surender. Thank you. Next, this is a question on which I have not been able to get the proper image. They had said, mark the layer of retina. They had given a diagram of the retina most probably, and they had asked the marking of some layer they had asked. Was there a question on this? Was there a question on this? This is a diagram which we have been doing repeatedly and in every class, whether it is your quick revision, whether it is your marathon series, whether it is rapid revision, we have done this diagram repeatedly. I hope you all were able to make this diagram absolutely correct. Okay, so you are saying outer nuclear layer, this is the layer of the nucleus of the rods and cones. Yes, layer of the rods and cones. It was a match the following. Okay, sequence was asked. Sequence was also we remember. We remember that there is pigment epithelium, then the rods and cones, then there is a nucleus, then the plexiform, then the inner nuclear layer, then again a plexiform, then ganglion cell layer, then the nerve fiber layer. We have done this repeatedly. This is something that we have done. Okay. Outer nuclear pigment, next plexiform. Acha, okay, they had asked you to there was no diagram there. There was no diagram there. They asked for the sequence. They asked for the sequence of layers. If you are saying this, sequence of layers, no diagram. Okay. So there was no diagram. Thank you for the clarification. Thank you, Dr. Anushka. There was no diagram. Diagram was Dr. Reem Ansari saying there was a diagram. Okay. So there was a diagram. If you can lay your hands on that diagram from the internet, please let me know. If this was a diagram, then I'm the lucky one. Okay. I'm too lucky then. Label the layer. Diagram and order asked. Diagram and order was asked. Okay. So there was a diagram. Let us hope that some of you can send me the diagram on my WhatsApp number. Again, if somebody is able to tell me, otherwise I'll keep tracing. Okay. Sequence was there. Match the following. It was a match the following with diagram. Okay. So match the following. What was in the column A and what was in the column B? Column A and column B? A, B, C, D. Acha, okay. So they had given A, B, C, and D. And the four choices were, sir, same diagram was given. Oh, awesome, awesome. Same diagram was given. Awesome. Yay, I am the lucky one. Good one, good one. Great. That means somebody known to me has set the paper. Okay, and what were the layers that asked? What were the layers they had asked? Uh, what was the layer? Pigment. Okay, pigment layer, outer nuclear layer, inner plexiform, ganglion cell. Okay, so pigment layer, outer nuclear, layer, then inner plexiform, inner plexiform, and ganglion cell layer. Okay, so these were the four choices. Ganglion cell layer. Okay, so they had made this in one of the earlier INI they had asked only one layer. In this one, they had given you the choices of A, B, C, and D. Okay, A, B, inner nuclear layer, C, ganglion cell layer. Okay, and D, the choice was the inner plexiform, outer nuclear, inner plexiform. Okay, so they had given an inner plexiform also. Okay, so they had given these four layers. Okay, okay, okay. Good, 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 good. Okay, so this is very clear. I hope you were able to answer this correctly. Okay. One question that you guys are telling me is regarding pterygium. One question that you guys are telling me is regarding pterygium, where they asked regarding pain. There is not going to pain. Astigmatism, yes. Astigmatism is a feature that is there because of the contraction of the muscle. There was there. Okay, sent on group. Thank you. Thank you, Dr. PC. Okay, what were the other choices? A, B, C, and D. Astigmatism is the correct answer. Pterygium causes. Pterygium causes astigmatism. That is the correct answer. RP, ONL, IPL, and GCL. Okay. Edema. No, it does not lead to any edema. It does not lead to any neuropathy. One question on best disease. Investigation choice we all know is electrooculogram, EOG. Okay, there was a question on best disease. Best disease is the only disease where your electrophysiological test, EOG, electrooculogram, it's a electrophysiological test. It is the only disease where EOG is of use. Okay, so that is best disease. Macular edema was another option. Edema, okay, or you can say macular edema. Macular edema. Anybody with the fourth option? Anybody with the fourth option? Doesn't cause pain. Visual disturbance. Visual disturbance. By astigmatism will lead to visual disturbance also. Then this becomes a tricky question. Visual disturbance will also be there. Chemical injury. Okay, they had asked about chemical injury also. There was a question on chemical injury. Visual disturbance. If visual disturbance is also there, then this can also be a correct answer. It will depend upon the language of the question and language of. Okay, Dr. Sonali is saying no. Okay, so one question you guys are telling me is on chemical injury. Is on chemical injury. Best step few hours back. Next step is this we have done. We have done. I have told you that chemically injuries is one topic which has been repeatedly being asked. So injuries is surprisingly there was no question on any visual field defects, but visual field defects and injuries. I've been telling you it is a repeatedly question asked. So chemical injury, we have done this in our marathon series also. The first and most important step is copious irrigation. Copious irrigation for good 30 to 45 minutes. Okay, so no visual disturbance. Now, I also think so that they cannot give visual disturbance. As per me also, this cannot be an option. Okay. Best management is copious irrigation is the first step that has to be done whenever. And it is, if somebody asks, it is going to be for 30 to 45 minutes at least. Okay. And with a solution which is easily available, not a neutralizing solution. any solution, ingle lactate or normal saline or even plain water can do. Okay. First, take history, go pace irrigation. No importance of history. Also, just start washing. Visual acuity. Okay. So one was visual acuity. Second was take history. Do not waste taking time in history. Okay. Viscoelastic substance. Viscoelastic substance. No role of any viscoelastic substance, beta. No. Acha, one question on viscoelastic substance. Okay. Okay. What was the question on viscoelastic substance? One question on viscoelastic substance you guys are telling. Viscoelastic substance. That was also one question. Okay, let us see the choices. Use. It is used in cataract surgery. It is used in cataract surgery to maintain the anterior chamber depth. Okay, it is used. Viscoelastic substance used in cataract surgery. Yes, it is used to maintain the anterior chamber. Take history also an option. Okay, I've written here, beta. I've written here take history, but it is not important. You can, as you start irrigation, you can simultaneously take history. Okay, you can simultaneously take history, but otherwise, whatever the chemical, washing has to be done. So ideally, do not waste time in asking the patient. Just start washing and then simultaneously take history. Can be left in eye post surgery. No, it cannot be. Can be left in eye post surgery. No, it cannot be. This is the incorrect answer. Silicone oil. No, silicone oil is not used as a viscoelastic. परफ्लोरोप्रोपेन नहीं होगा, परफ्लोरोकार्बन होगा. Perfluorocarbon. No, it is not a perfluorocarbon also. Sulfur. Yes, it is used to maintain during capsulorhexis. Yes, during capsulorhexis. This is a correct answer. During capsulorhexis, this is a correct answer. Yes. Used between anterior chamber and IOL. Okay. No, it is not used between. Okay, if the choices that you are saying here is multi-phasic ERG. Okay, and one you are saying is only ERG, but the correct answer is going to be electrooculogram. Correct answer is going to be EOG. Okay, Dr. PG Godlike 4. Is that okay? Retinoschisis, diabetic retinopathy, one question. Retinoschisis, myopia increases posterior lenticonus. Okay, one question you are saying on diabetic retinopathy. It was a question on diabetic retinopathy. Dr. Anushka, was that a question on diabetic retinopathy? Diabetic retinopathy does not lead to retinoschisis or myopia. It does not increase the posterior lenticonus also. Not seen in diabetic retinopathy. Okay. The not seen in diabetic retinopathy. Not seen in diabetic retinopathy. Dr. Study Bistro. Tractional retinal detachment, TRD. Tractional retinal detachment is seen. Tractional retinal detachment is seen in diabetic retinopathy. Okay, it will be seen. Used to maintain AC during IOL and capsulorhexis. Yes, Dr. Aspiring adrenaline, which is seen in diabetic progression of myopia. Progression of myopia. Posterior staphyloма. Posterior staphyloma is not seen. Posterior staphyloma is not seen. Retinoschisis. Retinoschisis Retinoschisis is also not seen, but I would go with the answer posterior cephaloma. It is a option seen in myopia, pathological myopia. But it will increase the risk of traction detachment. Yes. So the correct language of the question is very, very important here. Okay. On fluorescent angiography, FFA seen. Lot of question was seen. It was seen. So if you are saying which was seen, so it becomes seen in diabetic retinopathy, then traction detachment is the best answer. Traction detachment was the best answer. Not seen. Okay, correct. I have corrected this. So I have seen in diabetic retinopathy. TRD is definitely a complication of diabetic retinopathy. So it will be seen. Correct. Okay. On FFA. So there was a question on FFA also. Okay. On FFA, on fundus fluorescent angiography, microorganisms will be seen. Microorganisms will be seen as hyperfluorescent. Microorganisms will be seen as hyperfluorescent. Okay, beta ji. Hyper, because they will leak. So that is why it will give a more fluorescence. So hyperfluorescence will be seen with microorganisms. Correct. Microorganism is seen as hyper. Microorganisms are seen as hyperfluorescent. They would leak the fluorescein dye. This is what we have been telling you in case of a patient with diabetic retinopathy. On FFA, you can see the microorganisms as leaking. Hyper. Seen as hyper. Okay. Dot or branching vessel. Dot. It will be seen as a dot. It will be seen as a dot, not as a branching vessel. Branching vessel will indicate a new vessel. Okay. It will see a new vascularization. So in case of a new vascularization, you will see a branching pattern. Dot. Dot type. Will be seen as dot type, not as a branching vessel type. Will be seen as dot. Correct. So when you are seeing a dot, when you are seeing a branch. Okay. So the correct answer is dot. Dot is the correct answer. Branch is not the correct answer. Branch is not correct answer. Dot hyperfluorescence will be correct answer. Okay. Correct. Good. Thank you, everyone. Thank you for telling me so many more questions. We'll definitely come out with better options and the complete questions in a week's time. Options. So I believe there are options: hyperfluorescence dot, hyperfluorescence branching. Similarly, hypofluorescence dot and hyperfluorescence branching. Okay, I hope there were these four options. Correct? Yes. Good. So these were the questions, and I hope you were able to answer. And all the best for your results. My best wishes to all of you. May you succeed. And even if not, then don't worry. This is just an exam. Keep studying. Learning is a lifelong process. Okay. Please do not get disheartened. Nobody should get disheartened. Ophthalmologist. I mean, yes, ophtha is a major subject. Okay. आँखियों से, आंखें, eyes are everything. Good. चलो